Hi everybody, welcome to today's video. I'll be talking about the 5 factors you need to consider when choosing the treatment for endometriosis that's right for you. My name is Dr. Sylvia and this is Askawayhealth. We're the channel that provides you clarity and direction about everything medical. So like this video and subscribe to our channel, but for now, let's get into it. Okay, so this is one of a series of videos that looks at the menstrual cycle, and we're talking about endometriosis. In the previous video, we've talked about what endometriosis is, and we've explained that endometriosis is a chronic medical condition where tissue that normally exists within the inner lining of the womb is now found outside of the womb. So this can be within the fallopian tube or within the ovary, within the outer part of the womb, or just within the abdomen, and this can cause quite a lot of serious problems. We've said that endometriosis tends to happen more often in women between the ages of 30 and 40 years old. In this other video, which I've linked up here, we talked about the symptoms of endometriosis, and we explained that this could include anything from painful and heavy periods. It could include problems with pain during sexual intercourse, and some women with endometriosis may have problems getting pregnant. So endometriosis can have quite a serious impact on a woman's day-to-day activity. Now, if you want to get some more information about these particular topics, make sure you check out those videos. But like I said, today's video is going to be looking at when you've been diagnosed with endometriosis. There are a number of different treatment options that you're offered. How do you know which is the best choice for you? So make sure you keep listening to the end of this short video where I'll be explain to you how to consider these 5 factors and choose the one that seems most appropriate. Now, the treatment for endometriosis can either be medical, that is conservative, or surgical. Surgical treatment involves any operative procedure, while medical treatment looks like non-operative procedures. And the different options depend on the individual and depend on the particular issues around the diagnosis of endometriosis that they have. With medical treatment, it includes looking at use of medication that may amend the activity of the hormones that the body produces. In this particular video that I've linked up here in Understanding the Menstrual Cycle, I talked a little bit about the impact of hormones on the menstrual cycle and how they work, so you might want to check it out to get some more information about that. But in treatment of endometriosis, one of the options is medical treatment using these hormones that can have an effect on the menstrual cycle. Whether the treatment is medical or surgical, the aim is generally to control the symptoms of endometriosis because we do not yet have a specific cure for endometriosis. So bearing this in mind, the best that we can do is target specific symptoms and see how we can control them to help a woman who might be experiencing one challenge or the other with her diagnosis of endometriosis. Right, so to decide on which option is best suitable for you, here are the 5 factors that I think you need to consider when making your choice. Okay, the first one is age. The age is important, and it also relates to the position or the particular phase of the menstrual history or the reproductive history that a woman is at that stage in her life. And there are certain choices that a woman who is in her late teens or early 20s will take compared to choices that a woman who might be in her early or late 40s might decide to go with. So where you are in terms of your age and which aspect of your reproductive cycle that you are is an important factor to consider when you're thinking about whether a surgical option or a medical option is more appropriate for you in treating endometriosis. Second factor to consider is the symptoms. What are the symptoms that are in particular or severe in a woman with endometriosis? Now, it varies from one woman to the next. The severity or the degree of endometriosis is different from one woman to the next. And what I mean by that is in some women it might be very, very heavy and painful periods. In another woman there might be problems like constipation, very bad constipation, and there might be problems with pain during intercourse. So there are a number of different symptoms that could present as endometriosis, and you might find that there are some that are of less degree to others, and so the focus will be on addressing that particular symptom per woman. It may be that choosing surgery is the better option for a particular range of symptoms or a particular symptom, or medical treatment is the preferred option for another type of symptom. If, for example, as a woman's symptom is inability to get pregnant, and it's been decided that endometriosis is a strong factor in that particular case, then using certain hormonal treatments may not be appropriate, because those hormones will be doing things that limit the chances of getting pregnant. So it's important to actually consider what are the symptoms and decide the treatment based on those particular features. Yeah, so like I've just said, the third factor looks specifically at the choice of the woman. Does she want to get pregnant? And I reflected earlier about the age. Some women who are in their late 40s or early 40s perhaps may have completed their families already. And so when you're having a discussion with them about endometriosis, the issue really is not about fertility. It may be some other aspect of the symptoms. And so those women may be willing to undergo particular types of treatments that would not hamper their ability to get pregnant. But if you're having a discussion with a woman who is perhaps in her early 20s and not yet started a family, who's suffering from endometriosis, then whatever treatment choice that you would consider would be something that would certainly be tailored towards allowing her to preserve fertility. So that element is so important in that discussion or in your thinking about what to choose. Because you'd be saying to your consultant or your specialist that, well, you haven't started your family yet, and so we are interested in going down a treatment route that allows you to preserve and improve your fertility. Okay, now the fourth factor is, how do you feel about certain treatments? For example, how do you feel about surgery? Or how do you feel about taking hormones? Because these are certain treatment choices that will be discussed along the line as one is looking at your treatment pathway. And if you're the kind of person who doesn't want surgical intervention or doesn't feel that surgical intervention is right for you, it's important to let your doctors know. It may be that that is the only option that's available at that time, but it's important to have a discussion to look at, right, if I choose not to go down the route of surgery, what's going to happen? And if I choose to go down the route of surgery, what is going to happen? And then decide within yourself, maybe by talking to family and friends, what is best suited for you. But this is a good factor, or this is an important factor to consider. What is your preference? What is your preference in terms of the treatment choices that are available and that you think will be more suitable to you? So naturally, are you somebody who does not believe in taking hormones, who does not believe in taking medication? Taking hormones might include having them for a prolonged period of time. So if you're the kind of person who feels you're not able to have these hormones, it's important to put that into the mix when you're considering the options available. Okay, and the fifth factor to consider is, have you had any of the treatments available before? Have you had them and you've developed a side effect or couldn't tolerate it, or whichever situation it is? It's important to narrow it down, because obviously a treatment that you've had in the past that hasn't worked for you is not one that you're going to go down the route this time around. So that brings you to the point of having a discussion about what other options are available. I think it's important for women to be able to have access to all the information about the treatment options which your specialist or clinician will be able to provide to you. And the purpose for getting all that information is to help you decide which is the best for you at a particular stage in your life. So don't forget, let's go through them again. The first one is age. The second factor to consider is, what are your symptoms? That determines which particular choice you might go for. The third one to consider is whether you want to get pregnant again. Are you at the stage where you've completed a family, or are you just about starting your family? The fourth one is how you feel about a particular treatment option. Do you want to have surgery? You do not want to have surgery? Do you not want to have hormones? All these are important in making the decision. And finally, have you had a particular type of treatment before? Because if you have, then it probably will come off the list of your treatment options. So in the next set of videos, we're going to look into the different treatment options. We're going to have one video that looks like the medical treatment, and another video will be talking about the surgical treatment. So we've come to the end of this video. If you've liked it, please share with your friends and your family. Do consider to subscribe to the channel. If you've got any inquiries, feel free to send us a question that we'll be able to answer discreetly. I'm going to put our contact details in the description at the bottom of the video. But until next time, thank you for joining me. Thank you for listening, and I will see you in the next one.